Welcome to the CAASN channel. Our topic for today is the 30 benefits of vitamin D and its 12 drug interactions. My name is Abazar Habibinia. I have an MD degree and I'm the director of the Canadian Academy of Sport Nutrition. Subscribe to the CAASN channel on YouTube to enjoy the information that we share on a regular basis about medicine, weight loss, fitness, and sport nutrition. Okay, today we are going to discuss the 30 benefits of vitamin D and also its 12 drug interactions, and I'm sure you will be surprised to hear them. For today I have prepared for you slides. I'm gonna talk on the slides, then I'll be back at the end. Let's go with these slides first. Okay, let's discuss the 30 health benefits of vitamin D. Please keep in mind that vitamin D is considered a prohormone rather than a vitamin because it must be further metabolized to gain biological activity. Number one, bone health. I believe that most people, they think that they need vitamin D just for bone health. Vitamin D plays an important role in bone health by regulating calcium, phosphate, and magnesium. There are two bone diseases, as you can see on the slides, osteoporosis and osteomalacia. Vitamin D is extremely important in preventing and treating those bone diseases. And definitely we're going to have videos about those diseases in the future. Number two, immune system. Vitamin D is one of the most important nutrients for the immune system to function optimally. And we have discussed immune system in the past. Number three, cancers. Vitamin D has anti-cancer activities at least against 5 cancers: breast cancer, prostate cancer, skin cancer, colon cancer, and the pancreatic cancer. Number 4, tuberculosis. It is an infectious disease and vitamin D is used as an adjuvant treatment in tuberculosis. Number 5, multiple sclerosis. Vitamin D deficiency unfortunately increases the risk of developing multiple sclerosis and also its activity. This is why vitamin D is used as an adjuvant treatment in multiple sclerosis. Number 6, psoriasis. It's a kind of common skin disorder, and vitamin D and its analogs are used as an adjuvant treatment in those people who suffer from that skin condition, psoriasis. Number 7, heart muscle. Vitamin D is vital in maintaining normal function of the heart muscle. Number 8, diabetes. Vitamin D deficiency increases the risk of developing diabetes, both type 1 and type 2. And also epidemiologic studies indicate an important role for vitamin D in preventing and treating both diabetes type 1 and type 2. Number 9, insulin resistance. Vitamin D deficiency increases the risk of insulin resistance, and when you develop insulin resistance, you're gonna have difficulty metabolizing especially carbohydrates. Number 10, high blood pressure. Vitamin D deficiency increases the risk of high blood pressure. Actually, we have video about the connection between insulin resistance and high blood pressure. The video is already on CAASN channel. This is one of the posts that we posted on CAASN pages on social media. You see, here's the sequence of events in insulin resistance. When you develop insulin resistance, first the insulin level is gonna go up after basically eating. Then the insulin level is gonna go up in fasting status. And when your insulin level is high, that means you have developed insulin resistance. Your blood sugar is gonna go up, your LDL cholesterol and triglyceride is gonna go up, and your blood pressure is gonna go up. You see, high sugar, high cholesterol, and high blood pressure, D3, we call them D3 medical musketeers. Number 11, low-grade inflammation. Vitamin D deficiency increases the risk of developing low-grade inflammation. Number 12, depression. Of course, there is a strong link between depression and low levels of vitamin D. Number 13, asthma. Vitamin D deficiency can predispose someone to the development of asthma. Probably you have seen those people, they keep changing their medications, they keep changing their doctors from one hospital to another one, but their asthma is not responding to conventional treatment. Maybe they are suffering from low levels of vitamin D. Number 14, Parkinson's disease. Vitamin D deficiency increases the risk of developing Parkinson's disease. Number 15, gastric bypass surgery. You see, usually gastric bypass surgery is done sometimes as a sort of obesity surgery, and sometimes for those people they suffer from pancreatic cancer. Those people, they have had gastric bypass surgery, definitely they're gonna need higher doses of vitamin D. Number 16, no gallbladder. You see, if your gallbladder has been removed for any reason, because of the infection, because of inflammation, because of a trauma, because of a stone, actually you're gonna need higher doses of vitamin D. Because vitamin D, basically to be absorbed properly, needs bile. Bile is very important for the absorption of vitamin D. Actually, I have two interesting slides for, let me show them to you. Okay, this is the liver, and this is the green one. This is the gallbladder. Bile is produced in the liver, and basically it's gonna be stored in the gallbladder. And anytime you are having oily foods, gallbladder is gonna contract and releases bile. This is a part, this one, as you can see in here, this is called duodenum. It is the upper part of the small intestine. So gallbladder is gonna release bile into the small intestine to help the absorption and digestion of fatty foods. So when you don't have gallbladder, what's gonna happen? There is not enough bile to help the absorption and digestion of fat, and definitely vitamin D relies on the absorption of fat. And this is a bypass. This is a normal person. This is esophagus, stomach, and this is the duodenum. You see, this is the part, basically the gallbladder is gonna release the bile. I have highlighted for you with blue color. And when they do bypass surgery, they're gonna connect this part of the small intestine, as you can see, it's called a jejunum. They're gonna connect the jejunum to the esophagus, so they bypass the stomach and duodenum. This is why those people basically they have done bypass surgery, gastric bypass surgery, and those people, they don't have gallbladder, they're gonna need vitamin D higher doses. Actually, if they have vitamin D in the form of pills or capsules, is not gonna help them. They need vitamin D in the form of injections. Number 17, malabsorption. Any kind of malabsorption will affect the absorption of vitamin D, basically. Over there I have listed top 3 gastrointestinal diseases, inflammatory bowel diseases. 2 of them, we call them Crohn's diseases and ulcerative colitis, and celiac disease and cystic fibrosis. Cystic fibrosis, it's a kind of genetic disorder that affects mostly the lungs and GI system. If someone suffers from any of those medical conditions, I'm afraid they're gonna have malabsorption and they are not gonna be able to absorb properly vitamin D. Number 18, renal failure. Renal failure impairs the action of vitamin D. That means those people who suffer from kidney failure, they're gonna need vitamin D. Let me show you how. You see, when you develop renal failure for any reason, there is a protein, it's called FGF23. It stands for fibroblast growth factor 23. This is a kind of hormone that contains about 251 amino acids. In people with renal failure, this hormone FGF23 is gonna go up, and when this hormone increases, is going to blocks the basically vitamin D production in the kidney, and also is going to blocks the reabsorption of phosphate in the kidneys. This is why those people with kidney failure, those people, they go on dialysis. Actually, they have low levels of active vitamin D in their blood. 19. Low function parathyroid. Low function parathyroid can impair the activation of vitamin D in the kidneys. So whoever suffers from low function parathyroid, I'm afraid they're gonna need vitamin D. 20. Obesity. If someone has body mass index BMI 30 or higher, unfortunately obesity is associated with low levels of vitamin D. So obese people, they're gonna need the right amount of vitamin D. 21. Dementia. Vitamin D deficiency increases the risk of dementia. 22. Athletic performance. Studies show that higher serum levels of vitamin D actually can decrease the risk of sport injuries and also can improve athletic performance. 23. Fatigue and tiredness. There's a correlation between vitamin D deficiency and fatigue. Actually, those people, they go on kidney transplantation. Usually they suffer from fatigue and tiredness after their surgery. And according to few medical books, vitamin D can improve significantly fatigue among those patients. 24. Impaired taste during chemotherapy. You see, as you can see on the slide, 56 to 76% of those cancer patients, basically, they're gonna complain of changes in their taste during chemotherapy or after chemotherapy, and lots of studies show that vitamin D can help restore basically the impaired taste in some patients. 25. Loss of smell. Few studies indicate a correlation between vitamin D deficiency and the loss of the sense of smell. 26. Migraine. Some studies indicate a link between vitamin D deficiency and migraine attacks, and recently these days they say this is especially true among children. Those children, they suffer from migraine attacks. Maybe they're suffering from a low level of vitamin D. 27. Autoimmune diseases. Studies indicate a significant association between vitamin D deficiency and higher risk of developing several autoimmune diseases, for example, rheumatoid arthritis. 28. Non-scarring hair loss. According to few studies, vitamin D can be helpful in those people that basically they suffer from alopecia areata and female pattern hair loss. In alopecia areata, they have sort of hair loss, coin shape. We call it coin shaped hair loss. 29. Respiratory tract infections. Vitamin D definitely shows a protective effect against acute respiratory tract infections, especially among those people they suffer from low levels of vitamin D. 30. Cesarean section. Vitamin D deficiency is associated with an increased chance of having cesarean section, and also vitamin D deficiency increases the risk of late pregnancy complications. Let's review two interesting research articles. Article number 1. This article actually was published in April 2010 in Canada. The study has been done in Canada. Based on this article, actually they found many positive impacts of vitamin D on health. We're going to review 6 of them based on the article. I'm going to put the link for this article on the description of this video, and hopefully you can see it for yourself. Number 1, based on this research article published in April 2010 in Canada, if your vitamin D level increases, as you can see, from 75 to 105 nanomole per liter, the risk of cancer is going to go down by 25%. Number 2, if your vitamin D level increases from 62.5 to 105 nanomole per liter, cardiovascular disease is going to go down by 25%. Number 3, if vitamin D levels increases from 25 to 75 nanomole per liter, insulin sensitivity can improve about 60%, which is a lot. Number 4, vitamin D reduces the risk of developing multiple sclerosis, and if someone has developed multiple sclerosis already, definitely vitamin D can reduce the symptoms. Number 5, vitamin D reduces the risk of pneumonia by 30% through 2 different mechanisms. The first mechanism is this, reducing something in medicine we call cytokine storm, and the second mechanism is this, vitamin D basically induces the production of 2 antimicrobial protein. They are called, as you can see in here, cathelicidin and defenescence. Usually they are produced by white blood cells. So taking vitamin D reduces the risk of pneumonia by 30%, which is definitely a significant number. And number 6, adequate vitamin D can reduce the risk of primary cesarean section by about 50% by strengthening the uterine muscles. The second article was published in April 2020. Again, I'm going to put the link for this article on the description of this video, then you can check it for yourself. This is the title of the article, Is Vitamin D an important biomarker for symptom severity in COVID-19? Based on this article, those people, they had low levels of vitamin D, they had severe symptoms of COVID-19. "12 drug interactions of vitamin D." Number 1, corticosteroids. Corticosteroids, they are prescribed in medicine for so many reasons, from cancer to allergy to asthma to autoimmune diseases. There are many of them in medicine. Top 4 corticosteroid medications are, as you can see in here, prednisolone, betamethasone, dexamethasone, and triamcinolone. Unfortunately, corticosteroid, they antagonize the effect of vitamin D on calcium absorption. Number 2, phenytoin. This is a medication that is prescribed for epilepsy and seizures. This medication increases the metabolism of vitamin D in the liver. That means if you are taking phenytoin for seizure, epilepsy, you're gonna need vitamin D. Number 3, barbiturates. They are a group of medications that are prescribed for, again, as for seizure, epilepsy, and also as a sedative hypnotics. 2 commonly prescribed barbiturates are phenobarbital and secobarbital. Again, barbiturates, they increase the metabolism of vitamin D in the liver. So if you are taking basically any kind of barbiturate medication, you're gonna need vitamin D. Number 4, rifampin. This is a medication that is prescribed for tuberculosis and leprosy in medicine. Unfortunately, this medication increases the metabolism of vitamin D in the liver. This is why vitamin D level is going to go down. So if you are taking rifampin medication, you're going to need higher doses of vitamin D to adjust your vitamin D level. Number 5, isoniazid. This is another medication that usually is prescribed for preventing and treating the infectious disease tuberculosis. Isoniazid is going to impair the activation of vitamin D in the liver. That's why vitamin D level is going to go down. So if you are taking this medication, isoniazid, you're going to need the right amount of vitamin D. Number 6, ketoconazole. This medication is prescribed for fungal infections in medicine. This medication will impair the activation of vitamin D in the kidneys. This is why when you take this medication, the active form of vitamin D in the blood is going to go down. This is why you're going to need the right amount of vitamin D to adjust your basically vitamin D level. Number 7, thiazides. They are a group of medications that are prescribed for high blood pressure and edema. Two famous thiazides are hydrochlorothiazide and chlorothiazide. One of the side effects of thiazide medication, as you can see, is this hypercalcemia. That means calcium level is going to go up. Vitamin D can increase the risk of developing hypercalcemia from thiazide medications. Number 8, cimetidine. This is a medication that lots of people basically they take for stomach acidity and peptic ulcers. In many countries, cimetidine is a sort of over-the-counter medication. You don't need prescription for it. You can walk into any drugstore. You can pick it up from there. Unfortunately, cimetidine can lower the effectiveness of vitamin D. Number 9, calcium channel blockers. The three famous calcium channel blockers are, as you can see on the slide, amlodipine, nifedipine, and diltiazem. Calcium channel blockers are prescribed for high blood pressure and heart conditions. Vitamin D can decrease the effectiveness of these medications by increasing the blood levels of calcium. So if you are taking any of those calcium channel blockers and you are going to take vitamin D, definitely we suggest you discuss with your doctor. Number 10, statins. Statins, they are a group of medications that are commonly prescribed, to lower high level of cholesterol and also for heart conditions. Two famous statins are, as you can see on the slides, Lipitor and Crestor. Vitamin D may decrease the absorption and blood levels of those medications. Number 11, estrogens. Usually estrogens are used for hormone replacement therapy and also as birth control pills. When you are on a birth control pill or basically you are on hormone replacement therapy, estrogen, they increase the active form of vitamin D in the blood. Please keep in mind that estrogens, they have no direct effect on active form of vitamin D. Just because estrogens, they may lower calcium and phosphate level, this is why the active form of vitamin D in the blood can increase. And number 12, Orlistat or Xenical. This is a kind of medication that usually is prescribed for obesity. This medication decreases the absorption of fat, and because vitamin D to be absorbed properly relies on the absorption of fat. So when you take Orlistat for obesity, because fat cannot be absorbed properly, definitely you can have over there a problem with the absorption of vitamin D. I really hope you learned something interesting today, because we make science easy to understand. Now you know. If you don't want to miss the videos that we post on a regular basis on CAASN channel, you can subscribe to our channel on YouTube. To support us, you can share, like, or comment on this video. Until next time, stay safe, stay connected.